Moving on. Bangladesh is facing a major health emergency as a deadly measles outbreak spreads across nearly the entire country. Hundreds have reportedly died, with children under 5 among the worst affected. Hospitals in the capital Dhaka are overflowing with young patients as worried parents travel from remote villages seeking urgent treatment. Health authorities and UN agency warn the outbreak is escalating rapidly despite emergency vaccination efforts. A report. Bangladesh is struggling to contain a fast-spreading measles outbreak that has pushed hospitals and healthcare workers under immense pressure. Authorities say infections have now been recorded in nearly all districts of the country, with tens of thousands of suspected cases reported in just a few weeks. At a specialized measles treatment hospital in Dhaka, wards were packed with sick children suffering from high fever, breathing complications and severe dehydration. Doctors say most patients arriving at the facility are children under the age of 5. Families from remote villages and rural districts have travelled for hours and in some cases days, hoping to access better treatment in the capital as local clinics struggle to cope with the surge. According to the UNICEF situation report, children remain the hardest hit by the outbreak. More than 80% of reported cases involve children under 5, including infants too young to receive routine immunization. Bangladesh has now launched a nationwide emergency vaccination campaign as local media reports say the death toll linked to measles symptoms has climbed to nearly 500.
এটা যে হাম হইছে ডাক্তার নির্ণয় করতে পারে না, কিন্তু আমরা বুঝলাম যে এটা হামের লক্ষণ, যেহেতু বাচ্চার জ্বর ঠান্ডা কাশি এগুলো ছাড়ে নেয়, এরপর মুখে লালা যায়, এই জন্য আমরা খুব আতঙ্কিত হয়ে গেছি যে এখানে হামের লক্ষণই আছে। পরে আমরা সিদ্ধান্ত নিলাম যে আমরা এখানে রাখবো না, আমরা ঢাকা চলে যাব।
Anxious parents say delayed diagnosis and limited medical facilities in rural areas are forcing families to seek treatment far from home. As hospitals continue to fill up, frustration is also growing among parents who believed routine vaccination would fully protect their children from life-threatening infections.
সরকারের কাছে আমার প্রশ্ন হলো টিকা দেয় বাচ্চার নিরাপত্তার জন্য, লাইফ রিস্কটা কমানোর জন্য। তাহলে টিকা দেওয়ার পরও যদি এই ঝুঁকিটা থাকে, বাচ্চাদের নিয়ে যদি হয়রানি হইতে হয়, তাহলে এই টিকা দেওয়ার মানেটা কি? আমি মনে করি এই টিকা দেওয়ার চেয়ে না দেওয়াটাই ভালো।
Health officials insist vaccines remain the most effective protection against measles, but experts warn that gaps in immunization coverage, delayed treatment, and poor healthcare access may have accelerated the spread of the outbreak. Emergency vaccination drives are now underway across Bangladesh as authorities race to contain infections and prevent more deaths. But with hospitals still overwhelmed and new cases continuing to emerge, many families fear the crisis is far from over.